Hi guys. So again, a random doubt session. I know many people may not be here this time. They may be busy in their classes and all. But because I need to talk to you and I got this time, maybe these people will see the recorded session. So those of you are actually there, they can interact currently, and others can see the recorded session. So I had to tell you couple of things. So I'm just waiting for 30 seconds or more so that some people may join in. So recently, we have actually started so many activities. I hope you people have seen the previous year question session that we did yesterday. It's very very fruitful, and I have got awesome response and so many you know messages regarding the that session was very very helpful. So we are planning to do the same sessions for the other subjects also. Plus, daily we are doing the YouTube quiz and the Telegram quiz. So, guys, please see that also, because more you do the practice, whenever you are just studying, it gets boring and discouraging. But when you are doing this studies in the fun filled manner, I think then that is actually more fruitful, and small small efforts really counts. So if you are doing just 10 questions, that's 10 questions daily means a lot, because at the end of 50 to 60 days they become 500 to 600 MCQs. So number really becomes big if you see at the end. So a small quiz of 10 questions in the evening, 10 questions in the late night Telegram group, that will add up to your knowledge, and at the end you will see that your ophthalmology is already complete. You don't have to do anything. You can ask the questions, you can discuss your questions there. You can revise your previous year questions also. You are revising topic wise also. And at the end, I think because your paper is in May, so towards the end, in the last 15 days, we will be doing the mock test also, in which we will be giving the mixed back questions. Nowadays we are doing your topic wise, and this topic wise series will be completing in some days. Then tell me, do you want one more round of topic wise, or you want the mixed bag? We can do both ways. If you want a mixed bag type, we can do that way. If you want topic wise again, one round again, then we can do that way also. Plus, see, every time I may not be able to answer your query, but please, if it is long pending, then message me again, because once I visit the group, and if your message was long back, then I may not be able to scroll that back up. So please message me again or reply over that message, so that if any of the query is unanswered, I can see to it, because at times I may not, maybe in the classes or recording, so I will not be able to see at that time. Okay. Then regarding your GTs, please keep on giving the test. You may be busy nowadays because your papers are coming, and you may be thinking that why to waste the time in giving a test when I have not finished my syllabus. But by the my personal experience, and by talking to so many toppers, I can say at the end of the day, when you will look back, you will not regret that. And GTs will eventually help in completing that particular subject or that particular topic. It will eventually help. So please be assured that is not going to waste your time. Whatever you have prepared till then, whatever you have done, Please keep on giving the test, keep on doing the strength weakness analysis, keep on working over your mistakes. See, there are two ways of improving. One is that you increase the number of topics, increase the number of plus that you are doing. And second way is you keep on decreasing your mistakes. So you are actually increasing by both the ways, by increasing the number of positives and by decreasing the number of negatives. So you are reading every day, so you are increasing your number of positives. So please keep on working on your mistakes also in the GT. That will also decrease your number of negatives. So both ways you will learn, and eventually you will see that actually it helps immensely by improving your scores. Okay, don't actually depend your mood on the GT scores. Okay, sometimes it will be up, sometimes it will be low, so there's no point of crying over it. That is not the final thing for which you have to get the seat. You will get the seat on your final day. So we all have been working for that final day. Keep on working. Someday it will be very good, someday it will not be very good. Okay, all the days are not equal. But the thing is that you don't have to sit either way. Whatever time you are getting, maybe 20 minutes, maybe 30 minutes, maybe 2 hours, maybe 3 hours, or maybe the whole day, keep on studying. Now keep that thing aside that we'll do tomorrow. Keep that thing aside that I require that much time only for revising. Whatever time you are getting, see what little you can do in that extra time. So that little efforts will sum up to make a total success. Right. Now, regarding the ophthalmology, how to revise the ophthalmology? See, we have done so many rounds of ophthalmology. I think the best way of revising any subject is breaking them into small topics. So that is the same thing what we are doing in our quiz also. We are actually not doing only topic wise, we are also doing it subtopic wise. If I say revise lens, okay, so you have got so many things in the lens. So what you can do, you can put that lens also into subtopics. Sometimes you are reading the anatomy and physiology of the lens. See, is there anything that you are not able to answer in that? Then look at the types of cataract, the fancy names of the cataract. And hi Irfanullah, thank you so much from Pakistan, thank you so much. And then you read the cataract surgeries, the type of surgeries, then you see the complications of the surgeries, and then finally you will come to the lens anomaly. So each topic can be divided into 5 subtopics. Similarly, you can go for the glaucoma may you have to go with the anatomy and physiology of glaucoma. Then you have got the types of glaucoma may first congenital glaucoma, primary open angle, primary angle closure, and then secondary glaucomas. So every topic will have subtopics, so keep on revising like that. Similarly, if you go to the retina, now retina mein I will not say one topic, you have to read 2 topics at a time which are comparable to each other, like CRAO, CRVO, hypertension retinopathy, diabetic retinopathy, ROP, and RP, macular dystrophy, Stargardt disease, and your best macular dystrophy. Then we have syncytial scintillations and the steroid hyalosis. Hi Aditya, ABC from Nepal. Hi ABC from Nepal. So people from all corners, some Nepal, some Pakistan, are here. Very good. Ashu, it's Dashu or Ashu. Squint topic is very confusing. It's not confusing. Actually, we are not clear up with the concepts in cases of squint. So I always tell the students to go with the anatomy of the extraocular muscles first. Then only you are able to understand the squint. So if you go to my channel, I have given a deep explanation of the anatomy of the extraocular muscles. Once you are clear with the origin, their insertion, their movements, then obviously it will become easy. Please try to go through that. Okay. Mm, why and how do patient gets colored halos? Colored halos. Uh, Colored halos क्या है? First of all, try to understand. Colored halos means splitting of the white light. So white light consists of 7 colors. Whenever we have splitting of the white light into 7 colors, that will form the Vibgyor. Okay, so this person, when he's seeing this white light, it gets splitted all over this bright light. This is called as colored halos. There are 3 important causes of colored halos in whole of the ophthalmology. One is the cataract, one is your acute congestive glaucoma, and acute mucopurulent conjunctivitis. Why they are getting the colored halos? The reason is different in all three. In cases of cataract, it is the uneven opacification of the lens. In the glaucoma, it is due to the corneal edema. In the conjunctivitis, it is the mucopurulent discharge. Now, Fincham stenopic slit test is actually done to differentiate between the colored halos of the cataract and the glaucoma. If it is due to the cataract, due to the uneven opacification of the lens, they will get scattered. In cases of glaucoma, it is due to corneal edema, so no scattering. That is your Fincham stenopic slit test. Videos of case studies. Case studies means what? If you are talking about case scenarios, I have already made 40 plus videos of clinical case scenarios. If you go to the channel, write clinical case scenarios, you'll get whole of the playlist. What is the difference between corneal ulcer and keratomalacia? Obviously, there is a difference. Keratomalacia is actually a deeper form of corneal ulcer where necrosis has been done. So that is actually the xerophthalmia. And plus, the keratomalacia is a term which is reserved for the vitamin A deficiency. Dark room procedures. Uh, and the test important for INI-CT. Darkroom procedures. What are the important darkroom procedures? The simple one, you have got the visual field charting, you have got the refraction, all these are important. And the tests which are important for INI-CT. So yesterday we have discussed the questions of INI-CT. Whatever tests we have discussed in that, please go through that session. They are important. Squint tests are especially very, very important for your INI-CT. We have Hess charting, we have got the diplopia charting, we have got the test of stereopsis. Whole of those tests are especially very, very important. All right. Treatment of the diabetic retinopathy. See, diabetic retinopathy treatment is a management. It's not a treatment because the visual acuity which has decreased is actually irreversible. So we can only manage it. Now, management depends upon which stage the person is, whether he is an NPDR or he's in PDR or the maculopathy or in the stage of complications. So in the beginning, you have to control the blood sugar only. Then in the NPDR stage, whatever lesions we have got, you have to do the pan-retinal photocoagulation. Then we move on to the stage of PDR, proliferative diabetic retinopathy. There you are doing the what you called as the laser of those lesions. And if it is leading to the recurrent vitreous hemorrhage, you have to give the treatment of vitreous hemorrhage. Then we have got the maculopathies. For the maculopathies, you have to either do the focal laser or you can give the intravitreal triamcinolone. Then for PDR, you also have to give the anti-VEGF agents. Anti-VEGF agents are three. We have bevacizumab, we have got ranibizumab, and then we have got the pegaptanib. And finally, the treatment of complications like we have TRD. So for that, you can do the pars plana vitrectomy. I told you na Datta, the clear cut difference वही है. Actually, it is the you can say one step further of corneal ulcer. जैसे corneal ulcer less than one third, corneal ulcer more than one third. So keratomalacia is also, but it is actually necrosis which is occurring due to the ulcer. Okay. Um, is RD possible in young people without any history, trauma or medical history? Yes, it is possible. RD is possible, especially in those people who are having high myopia or pathological myopia, having the lattice degenerations. They can be having the retinal hole, and retinal hole can lead to rhegmatogenous retinal detachment. So obviously, it's possible. Yes. Uh, Khurana says keratomalacia is corneal necrosis without the inflammation. Yes, it's correct. But pathology faculty says necrosis is inflammation. Actually, necrosis is not inflammation. Necrosis is cell death. Cell death can take place due to any reason. Necrosis is not equal to inflammation, and necrosis means cell death. Cell death can take place by necrosis also, by apoptosis also. So you have to correct yourself, okay? And don't put so many stars and so many words, है ना? Without these complications, is RD possible? See, most of the time it is not spontaneous. We have some reason for that. We can have exudative RD also, that can be due to renal hypertension. We can have diabetes, that can lead to tractional RD. We can have Coats disease. We can have a rheumatogenic retinal detachment due to any of these reasons. So we require some predisposing factors. Means RD is something which is taking place due to any of the predisposing factors, depending upon what type of RD it is. जो भी टाइप की आरडी होगी उसके अकॉर्डिंगली आपको प्रीडिस्पोजिंग फैक्टर्स मिलेंगे. आई थिंक आई एम क्लियर, इरफानुल्ला. Hi Kriti, how many previous years do we have to solve for INI-CT? Beta, INI-CT के लिए you don't have to do just the INI-CT, you have to do both NEET and INI-CT. So yesterday I did a previous year question session on official channel of DBMCI. Please go through that. All the important papers we have done. NEET 2018, 2019, 2020. 21 तो obviously करना ही है, वो तो अभी हमने थोड़े दिन पहले ही recall we have done. And INI-CT के you have got only 3 papers, two in the 21, then one of 20. Then if the time permits, you can do some of the AIMS papers also up to 2018. उससे पहले का करने की जरूरत नहीं है. ठीक है. uh, yes, okay. Clinical features of the diabetic retinopathy. Clinical features of the diabetic retinopathy actually depends upon the type of the, what is the stage of diabetic retinopathy. Like if it is NPDR stage, you will just have the microaneurysms, you will have dot and blot hemorrhages, you will have the what you called as the hard exudates, you can have AV shunts, we can have venous changes. If it is a stage of PDR, then you will have a lot of neovascularization that can lead to recurrent hemorrhage. If you have maculopathies, then you will have the exudates and edema near the macula, and then you can have a stage of complications. The type of vision loss will again depend upon what stage the person is having. Like if he is in a stage of PDR, then you will have recurrent vitreous hemorrhage, then you will have sudden vision loss. But if he is having only the diabetic retinopathy, NPDR में gradual diminution of vision hoga, or in TRD also you will have gradual diminution of vision, so it depends upon that. Corneal dystrophies are not that important for INI-CT. I cannot see any question in the last few years of the INI-CT, so it's not that important. And I think you should, now it's a time to first concentrate on important topics, है ना. सब कुछ करने की वजह से what we are doing is we are missing out the important things, and mostly the question will come from important things only. The things which are actually not that important, or the topics which they will be asking, which are not the ones which I have frequently asked for, nobody will be able to do them. So those are not the questions which will decide your rank. The deciding factors and deciding ranker questions will be the ones which are from the known topic. So you have to just revise them again and again, again and again, right? Yes. Any other thing, guys? So please, what you can do for this any random doubt session, please keep on noting your doubts in one particular notebook, so that whenever I come, because I have not telling you in advance, because sometimes I'm not able to appear at that particular time because of my busyness. So please keep on noting your doubts, so that whenever I come live, you can open that notebook and you can fire the questions on me. Pseudo hypopion means it appears as if there is a pus in anterior chamber, but actually it is not. This is a feature of pseudo uveitis. You can get this type of thing in cases of intraocular tumors also, like in retinoblastoma, malignant melanoma, you can have these pseudohypopion's. Right? Online transactions. Naam bahut acha. Online transactions. Mm, yes. And please keep on revising the images also. I have given you the fundus image based sessions also, YouTube channel pe hai. Please keep on revising them, because images are a must both for INI-CT and NEET. So that is again a kind of mini revision that is going to give you very, very important. Please keep on revising your images. Ophthalmic manifestations in eclampsia. Ophthalmic manifestations in eclampsia, most important is your ERD. So if they are asking you about eclamptic retinopathy, please remember about your ERD. That is very, very important. Then you should also know actually what are the other things which are occurring in eclampsia, because basically they will not ask you just the ophthalmic part of the eclampsia. It's a OBG topic. So integrated question can come. Plus you should know all the OBG in, manifestations of the eclampsia also. Okay. And plus I have started posting the mantras on my YouTube channel. This is very fruitful and very, very beneficial for the last minute revisions of your INI-CET as well as your NEET exam, because sometimes you're not able to remember the systemic features or the ocular features. So mnemonics will be helping you like anything. Make a notebook of mnemonics. Every day you get a mantra, every day you get a mnemonic for that thing. Write that and revise every day. I think in the last, if I am giving daily one mantra, in the end, after 50 days you will have 50 mantras, 50 mnemonics, and that will cover all the important topics of your ophthalmology. 50 important topics. Then in the last session, last night, the session that I had done, previous year question, I had given about 30 important topics that you have to read from the previous year question. So obviously you have to do those previous year questions. Along with those previous year questions, you have to also revise those topics, because it is actually the topics that are repeating and not the just the question. So please revise all those topics thoroughly. Get a list from the session yesterday and start revising those topics. I'll be giving you quiz on those topics also. um Images before exam, plan images. Yes, what we can do, abhi to nahi, but towards the last we can plan the image based quiz also. We will plan the image based quiz over the YouTube or maybe on the Telegram, and let us see, we can revise those images also. And if you have any problem, then we can discuss those images also, right, Swaroop? We will do it. So, all right, guys, take care. Okay, I'll be coming now. Maybe I'll come without information. So, keep on adding your queries in one notebook so that we can ask you. Okay, so take care. Bye bye.